In today's Frontline Diaries, we connect with Dr. Matthew Lipinski, ER physician at the Ottawa Hospital. Dr. Lipinski, thank you for being here. I understand this is your first year as a full doctor in the ER. Talk about a memorable start to your career, right?
Yeah, absolutely. It's definitely been one that I didn't expect when I first started, that's for sure.
You guys, though, I guess, are better prepared than any of us to sort of deal with a pandemic. You're trained in emergency medicine. You're expecting the unknown.
Yeah, absolutely. I mean, emergency medicine, unpredictable things are just sort of name of the game with that. So I think the training that we've had, as well as all of our allied health nurses, everyone else, has given us the ability to quickly adapt to our new reality with COVID-19 and the pandemic.
How much are you anticipating a second wave to be a factor, certainly with the numbers we've seen jumping in September as we go forward here in the fall?
I think a lot of the public health initiatives that people are doing, mask wearing, hand washing, all that's been really great. And I think that that's probably going to make a difference in at least blunting what that second wave looks like.
Do you feel more prepared now, given back in March, April, it was all about the big unknown. Now there are some lessons learned that I'm sure you're applying in the ER.
Absolutely. The first time it happened, we were all just learning as we go, on essentially on the run. And now, with it sort of dipping down a little bit and now having a bit of breathing room, we've been able to fine tune some of our systems and processes in the emerge that I think will serve us better as we move into the fall.
As we've all taught our kids to wear masks and whatnot over the last few weeks, talk to me about your routine, because you guys are in the full PPE for that entire shift, and then you have to take it off properly at the end of the day. How does all that work?
Yeah, it definitely has been an adjustment, from before when we would wear PPE or masks just for particular patients. Now I'm wearing masks, goggles, and often gloves and gown for up to 8 hours or my entire shift. So it has taken a bit of getting used to, for sure, even with patients and trying to have that patient rapport. But afterwards, taking it all off and going outside in the fresh air it's given me a new appreciation for going outside. And then once we get home, a lot of us have a routine where sort of everything comes off, you hop straight in the shower and just decontaminate before you spend time at home.
And once you do get a chance to spend some time at home after, I'm sure, very busy days, what do you like to do to kind of unwind and get away from the craziness of hospital life?
Yeah, absolutely. There's not as much to do now with COVID and all of the sort of limitations, but my wife and I try and go outside for walks and hikes, and we got a cat at home, so it's easy to decompress when you're playing with a kitten. So that's been nice.
Love that. And do you find it's important not only for you to decompress, but for your wife as well? Is she also in the healthcare field, or?
Yeah, she's also a physician. She does women's health and is in clinics and does procedures. So I think it's been important for both of us to sort of have an area separate from healthcare and our work, just to be able to sort of reconnect and decompress a little bit.
Thank you very much for your time. Best of luck as you go forward through the fall and into your career full time.
Thank you very much. Thanks for having me.